Brachial plexus. Brachial plexus. Brachial plexus is a bundle of nerves which are formed by the ventral rami of C5 to T1, which passes through the cervical axillary canal and supplies brachium, antebrachium, and manus. Components of brachial plexus. Components of brachial plexus. Roots, trunks, divisions, cords, and terminal branches. Roots consists of C5 to T1. Sometimes C4 joins with C5. Plexus is also found which is known as prefix type, and occasionally T2 joins with T1 is known as postfix type. Trunks. Upper trunk is formed by joining of C5 and C6. Middle trunk is C7 continues as middle trunk. Lower trunk is formed by joining of C8 and T1. Divisions. Each trunk divides into anterior and posterior divisions. Hence, totally there are 6 divisions. Joining of these divisions forms the cord. The cords. Anterior division of upper and middle trunks join to form lateral cord. Anterior division of lower trunk continues as medial cord. Posterior division of all the trunks unite to form posterior cord. Supraclavicular branches. Branches. Supraclavicular branches. These branches arise above the clavicle. The branches are from the roots: dorsal scapular nerve with root value C5, a branch to join the phrenic nerve with root value C5, long thoracic nerve with root value C5, muscular branches to longus colli and scaleni. From the trunks: nerve to subclavius and suprascapular nerve. Infraclavicular branches. These branches arises below the clavicle, and the branches are from the lateral cord: lateral pectoral nerve, musculocutaneous nerve, lateral root of median nerve, from the medial cord, medial pectoral nerve, medial cutaneous nerve of the forearm, medial cutaneous nerve of the arm, ulnar nerve, medial root of median nerve, from the posterior cord, upper subscapular nerve, lower subscapular nerve, thoracodorsal nerve, axillary nerve, radial nerve. Applied anatomy. Applied anatomy. Erb's palsy. Site of injury. The region of the upper trunk of the brachial plexus is called Erb's point, where the 6 nerves meet. Injury to the upper trunk causes Erb's paralysis. Causes of injury: undue separation of the head from the shoulder, which is commonly encountered in the following: birth injury in shoulder dystocia, fall on the shoulder. During anesthesia. The nerve roots involved are mainly C5 and partly C6. Muscles paralyzed are mainly biceps brachii, deltoid, brachialis, and brachioradialis, and partly supraspinatus, infraspinatus, and supinator. Commonly involved nerves in Erb's palsy are suprascapular nerve, musculocutaneous nerve, and axillary nerve. Deformity and position of the limb developed in Erb's paralysis are: arm hangs by the side and is rotated medially. Forearm is extended and pronated. Arm abduction is lost. Flexion of elbow is lost and supination of forearm is lost. Due to paralysis of biceps, a classical position of the affected limb is known as policeman's tip hand or waiter's tip hand. Biceps and supinator jerks are lost. Sensory loss occurs over the lower part of the deltoid. Regimental batch area. Klumpke's paralysis. Klumpke's paralysis. Site of injury in Klumpke's paralysis is lower trunk of the brachial plexus. Causes of injury: undue abduction of the arm, as in clutching something with the hands during a fall from a height. Sometimes in birth injury due to difficult breech delivery. Cervical rib. Nerve roots involved, mainly C8 and partly T1. Symptoms: paralysis of intrinsic muscles of hand. Paralysis of the ulnar flexors of the wrist and fingers. Flexor carpi ulnaris. Patient presents with claw hand, hyperextension at the metacarpi phalangeal joints and flexion at the interphalangeal joints. Due to involvement of T1 can result in Horner syndrome, where patient presents with ptosis and mitosis. Vasomotor changes. The skin area with sensory loss is warmer due to arteriolar dilation. Trophic changes. Long-standing case of paralysis leads to dry and scaly skin. The nails crack easily and atrophy of the pulp of fingers.